Hello, grab your tea and relax. Thank you so much for expressing an interest in becoming a tutor at Tea Time Teaching. My name is Tavala, and in this video I'm going to talk you through the PowerPoint presentation template I have made, which will act as a mini guide in order to help you plan your lesson. The actual content in this presentation is really similar stuff to what's already in the Microsoft Word document guide that I've sent out. However, this does have a different visual, and we do encourage our tutors to use this presentation. This will give our course a bit more of a consistent theme and also encourage use of visuals. There are a few bits and pieces that I would like to show you guys how to use, so let's crack on with it. First off, we've got the title, which you can edit, and your name plus any other details. For example, if you've got any social media channels you want to add, or your location. It's all really up to you. Another thing I'd like you guys to note is the fact that our logo is actually embedded into the background, which means that when you add pictures and text to the PowerPoint presentation, you won't have to think about having to move around the logo. So it's just to make things a bit simpler for you. If for whatever reason the background doesn't load on your computer, then please do get in touch. Slide number 2 is why this topic matters. We are keen to have some data or graphs slapped on over here. So this you can edit here, or you can just stick a picture on top of this. Obviously you can adjust the size of the square. Essentially, we would like our students to know why they should care about understanding your topic. We would encourage you to use up to 3 objectives just to make things a bit simple for the students. They know what to expect in the 20 minutes that they have with you. Next up is the case. You are welcome to leave the slide as it is. Slide number 4 is the history. This image here you can move around, you can delete if you want to. It's a really cute illustration that I've made, so if you want to keep it, you can keep it. The next slide is the history. So here you can go into your case-based discussion. You can talk about the presenting complaint, history of presenting complaint, any past medical, surgical histories. Allergies is an important one, so as long as you include that somewhere in the presentation, that's good enough. Any brief categorization of current medications. For example, if they're on statins, you might want to just call it statins rather than going into the specifics. Is it atorvastatin, rosuvastatin, family history, and anything about their social history that might be relevant to your scenario. If you would like to add extra slides, you can just duplicate this one in order to sort of break it up rather than give all the information in one go. Next is examination. So here in this box I've included a prompt to add the obs for the patient. Again, you can just edit this and add whatever numbers you want. We would encourage the use of a systematic approach. The reason is, in stressful scenarios, our minds tend to get a little bit jumbled, and having a systematic approach means that there's always something to fall back on. Lesson after lesson, if we're encouraging our students to think of A to E assessments, then hopefully that can be instilled into them by the time they start in August. Here at Tea Time Teaching, we would discourage the use of real-life patients, and the reason is the whole consent process and all of that can be a little bit tedious. So you can keep your scenarios as realistic as you want, and we'd encourage that. Use some red herring symptoms and signs if you want to distract from the scenario, because often in real life things do present like that. So yeah, get creative. Now here's the really exciting part. In the way that we would document patient's notes, so we draw the little chest symbol, a heart maybe, the abdomen, and ankles. I've tried to include that style into this presentation. Here at Tea Time Teaching, we're enthusiastic about using this transition from med school to life as a doctor, and therefore including a glimpse of how we actually document in the hospital setting will sort of give them a bit more familiarity for when they do start. So here we've got the lungs, and you can move these little crosses around. You can copy and paste in order to, what's happened? In order to create more crackles, or you can delete these little crosses. Again, you can add your respiratory findings here. Heart sounds, you can write heart sounds 1, 2 plus 0 if there's no murmurs. Again, this is just really quick stuff. And again, same for the abdomen, we have these little crosses that you can copy and paste. We've also got this little drain, so you can rotate it however you'd like to. And then here's the catheter. So again, you can either keep these or you can delete them, and these are just things to think about here. Next is the ankles. Again, just comment on whatever you think is relevant. Slide number 10 is differential diagnoses, and this is really to sort of encourage people not to get fixated on a certain diagnosis. This is to help our students think of other similar conditions that we need to rule out or sort of investigate the possibilities of. Next up, we've got investigations. Here at this side, we've got the blood results. So you can plug in some numbers here. White cell, just make it 20. And obviously, if you wanted to add some more stuff like lefties, then you can do that, and I don't know, whatever you want, bilirubin, and extend the box. You can change the size if you wanted to, that's all up to you. We would like our investigations to follow the UK guidelines. If you wanted to add some blood gas results, you can do that as well as imaging. Again, if you wanted to split this slide into a few different slides so that the information is not all delivered at once, then feel free to do that too. This little image you can move around or delete or keep depending on whatever suits you. Next is the management, again UK guidelines. One thing we would like to encourage you guys to do is encourage the need to think about stabilizing the patient. Also mention what you would do immediately to treat and manage your patient, what the definitive treatment would be, what you may consider in the long run, any follow-up plans, and also what safety net advice you would give to your patient. Comment on any complications. For example, in pancreatitis, there might be a fluid collection around the pancreas that might need drainage, which may be a bit different to what your textbook example of pancreatitis might be. Towards the end of your presentation, we would encourage a Q&A with your audience. Mahmoud and myself may ask you a question. If you do have a question you want us to actively ask you, then do let us know in advance. Also, we're keen on having like homework type questions where people can go off and sort of research and learn more about. So if you wanted to leave questions like that, then feel free to do so. As for the next steps, please encourage your students to fill out the feedback forms. We will need the feedback forms from them if they would like their certificate. So that's one way to, I guess, encourage them. Feel free to send us some MCQ style Q&As as well. These will go on our Tea Time Teaching Instagram page. If you haven't followed it already, then go and follow it. On a fortnightly basis, we will be hosting live Q&As with doctors on my YouTube channel. The idea of these live Q&As is in order to, rather than give knowledge about certain medical or surgical conditions, these sessions will focus more about sharing your experiences and any tips about starting off as a junior doctor later this year. The way YouTube live Q&As work is that people can comment their questions at the side in the chat box, and you'll be on camera. So you can talk about whatever it is you want, or you can address the questions if that's what you want to do. Either way, you'll have the flexibility to lead the session and you have full control of the direction. If that sort of thing interests you, then please do get in touch with me. Last but not least, please thank your students for coming to your lecture, and we are happy for you to leave the last slide as it is. There's not much work that needs to happen there. Thank you so much once again for volunteering and taking your time out to become a tutor at Tea Time Teaching. We are confident that the work you put in will be well received by the medical students and any other students or junior doctors that tune in. Once again, thank you so much for your time and efforts. Have a lovely day.